Ovarian cancer is probably the most deadly gynecologic cancer. To date, probably 1 in maybe only 39 women are diagnosed with cancer over the ovary every year, but it is the most lethal gynecological cancer, so about 12,000 women a year die from the disease.
If the cancer is discovered at the early stage, so stage 1, the survival is excellent, probably 85–90% or better. But if, as usually it is discovered at late stage, survival is less than 30%. So one of the reasons for such a dismal fact is that we do not have a good screening diagnostic marker for ovarian cancer.
Up to date, there's only been limited detection methods that include a blood test for CA-125 levels, which have limited detection ability, as well as pelvic examination and transvaginal ultrasound. BCL2 is normally a cellular protein that is involved in what we call programmed cell death. It controls whether a cell should undergo sort of cell death when it has reached its end limit. It has not generally ever been found outside the cell, and so our studies are very novel in that, for some odd reason, the ovarian cancer cells, shall we say, shed this protein as well. So far, our studies to date indicate that urinary levels of BCL2 appear only elevated in women with ovarian cancer. It does not appear to be elevated in other forms of cancer. So this may be a rather specific biomarker for ovarian cancer. We are currently collaborating with individuals at multiple institutions, including the MD Anderson Cancer Center, to validate how well urinary BCL2 stands up as a urinary biomarker to detect the disease. Up until our studies, there had been no indication that there may be urinary proteins that could be used to detect ovarian cancer. The use of urinary proteins and obviously provides very easy, economical testing for the disease, and we could test at long distances.
So I think that urine provides us a human specimen which should be readily available, through non-invasive approaches, and should make also this test available not only to population of larger city, but also population of women at risk in underserved areas in this country and abroad. So I think that brings the innovation and the applicability of our current study.
You can spend years struggling and almost feeling defeated, but one happy moment, one good piece of data will keep you sustained for a long time.